Hello, this is Patrick James Lynch, founder of Bloodstream Media, host of the Bloodstream podcast, and I am chiming in because today's episode of the Ask the Expert podcast with Chris Bombardier is a pretty special one. Chris invited on Debbie de la Riva, who many in the community may know. She's had a number of different roles. Her family is very involved in the community in general. Her background as a social worker and with a specific focus on mental health, anxiety, depression, and suicide prevention is particularly relevant today in a climate where we're talking more about the needs related to the mental and emotional life of all people, but particularly those affected by hemophilia and other bleeding disorders in our community. So Debbie has come on for what turned into a lengthy conversation on this really important topic, a very honest conversation. And Chris invited me to be a part of that conversation. So you're going to hear my voice throughout today's episode. In fact, it'll open with Chris and I having a back and forth about our personal experiences with depression and our journey to talking about that, to identifying that as being true, to talking about that with professionals, to talking about that publicly. So you're going to hear us chat about that and then bring Debbie in to hear her expert insight on this really important topic. So the episode is going to be a little longer than usual. Believe's incredible editor, Allison Stoney, hello Allison, has done a great job of tightening this conversation up so that it flows really well, but I'm just acknowledging it's on the longer side. I hope you enjoy it. I think you will. Also, we do have other podcasts I want to make you aware of. My wife and I, Natalie and I, host the Bloodstream podcast. The most recent one from just a week ago features a young woman who during her pregnancy discovered, hey, turns out you have hemophilia C. So we had her on to talk about what it is to get diagnosed as an adult during pregnancy, to find out that your child may have something while you are pregnant and how that influences the conversations that you have around your birth experience and with your partner and what you're planning for. We also talk about step therapy, the new VWD guidelines, so a lot of good stuff over on the Bloodstream podcast. And the latest episode of the Powering Through podcast features Paralympic athlete Lacey J. Henderson, who had to lose one of her legs due to cancer, but has gone on to become I think she's a 5-time national record holder in the Paralympics. She's incredible. Seth Rojani, who's from our community with hemophilia and plays wheelchair basketball and coaches wheelchair basketball, is an incredible athlete who's living with hemophilia and is also, I believe, type 2 paraplegic. And Chris's mom, Kathy Bombardier, is a guest on that as well, giving the parents' perspective on what it is to be the mom of the adventurous hemo that is Chris Bombardier. So check out the other podcasts that we have through Bloodstream Media as well. You can find them at bloodstreammedia.com. And of course, the Ask the Expert podcast this month's and every month is brought to you by the good people at Living with Hemophilia, the online hemophilia community from Bayer. Living with Hemophilia is the destination of choice for a plethora of useful info. And by the way, great job, folks at Living with Hemophilia, on using the word plethora, like medical and non-medical tips, helpful advice, information on programs for all ages and stages, leadership opportunities and initiatives, sewing patterns, need those, and videos, the best videos. And because it's on the internet, it's easy to find. Simply type livingwithhemophilia.com into your search bar, and there you are. Thank you, Internet. That was easy. But of course, you'll do that after you listen to the podcast. Join Bayer's community of fellow hemophilia patients, caregivers, and advocates as they put the live in Living with Hemophilia. Just don't tell them that live has an E and living doesn't have an E, because that would get really confusing. You can even like them on Facebook. That's even better, because you can use emojis on their Facebook page and receive all the latest updates. So, check out Living with Hemophilia, and before you wish happy birthday to that friend from 3rd grade or share a funny meme about cats and Mondays, head on over to Facebook and like Bayer's Living with Hemophilia page. You'll be glad you did. And you'll be glad you listened to this episode of the Ask the Expert podcast with Chris Bombardier, featuring guest Debbie de la Riva, talking about anxiety, depression, mental health, mental illness, and suicide prevention. Enjoy.
When Patrick asked me to host the Ask the Expert podcast, we had a ton of discussions about what potential topics might be, and we wanted to tackle topics that are important to the community and not just obvious and easy ones. We wanted to dive deep into tough topics that we really need to talk about, and one of those topics that we've been wanting to address for a long time was around mental health issues in our community. Since this is such a challenging topic and one that has directly affected Patrick and I, we thought it would be best to have both of us be on part of this discussion and interview. So welcome, Patrick, to, I guess, your podcast, but now my podcast. So welcome back.
Thank you. It is good to be back on what is certainly now your podcast, and you've been doing an awesome job with it. But I'm glad that we're doing this one together for the reasons that you just laid out. So thanks for inviting me onto it.
Yeah, absolutely. I think we've been talking about doing an episode on mental health for months now. And so I guess we could just maybe start by touching on why mental health is important for both of us and why we wanted to do a topic about mental health.
So just to speak personally, like why I think it's important, as you mentioned, it's something that both you and I have challenges associated with. And it feels like something that we as a culture are struggling with. And within our community and within my life personally, I've just seen how it has such an insidious effect in some ways on every other aspect of life. If my head isn't right, my entire day is influenced by that. If I have an elbow bleed, like, okay, I got to account for that in certain ways, but it's probably not greatly impacting my ability to talk to my mom on the phone and like have a pleasant conversation with her. But if my mental health is off, my whole day is affected. Everything is affected, and my relationships to people are affected by it. I am worried I'm coming off as being something I'm not because I'm in a different state. So it's so all-consuming, and yet it doesn't get a lot of airtime. So it's a topic that we're not going to solve mental health crises or issues here today, at least not all of them. But we need to continue to contribute to the conversation and contribute to this environment where it's comfortable to talk about mental health, it's comfortable to talk about depression, it's comfortable to talk about suicide, and I think that's what we're doing. I think that's why it's important. We're contributing to that environment where it's comfortable. But what do you think? Why is it important for you personally, Chris?
I have a lot of similarities. We've chatted about this a lot in the past. Back, in my early 20s, I was really struggling with having this chronic medical condition and managing it. And like you said, it becomes like all consuming when you have that negative thought pattern and you're struggling with depression. It, really overcomes you and it distracts you from everything. And I didn't know that anybody else was struggling with it. It felt like an internal battle that I was kind of fighting on my own. And the strange thing is when I started talking about it with other people in the community, it seemed like everybody was struggling with this in some way or at some point in their life, not even just people directly affected with bleeding disorders, but, parents of kids with bleeding disorders, significant others, it seemed like it was like almost an all-consuming, it affected everybody in some aspect in our community, yet nobody was really talking about it. Or if they were talking about it, it was very superficial and kind of just like mentioned, but just passed on. And I don't know, it always just seemed like if it's affecting everybody, we should have more open discussions about this. And instead of putting it on the back burner or making it like stigmatized, we should just talk about it and make people realize that they're not alone if they're struggling with this stuff, not having to keep it to themselves. So that's where my like desire to get this podcast out there came from, was just making sure people know that they're not the only ones that struggle with mental health issues. And I think in particular with chronic medical diseases is, depression issue. I think a lot of times we get distracted by calling it just mental health challenges when it should be more about depression directly and actually using that word depression instead of trying to just, it's a mental health issue. That seems so random and just like generic. We should actually talk about what the thing is.
I totally agree. And it's like we've kind of broken through one barrier. We can say mental health to a degree. We can say anxiety a little more comfortably than several years ago. I feel like depression isn't at the same place. And, I know we're going to get into this, the meat of today with Debbie and the interplay between depression and suicide, but we need to be willing to use those words too, as you're referencing. So thanks for creating the space for today, Chris. This is important.
Thanks for being so open about, your struggles in the past too. You did write a blog post a month ago, maybe 2 months ago, that really like spoke to me and I think was very honest and open about your struggles. And we'll obviously put a link in the description and program notes to that blog post, but could you just share a little bit about what you wrote in that post and why you decided to share it when you did?
Yeah, the title of it, it's called Okay, I'll Admit It, I'm Depressed. And I've been really hesitant to want to talk about it, to be honest. And I wrote about that. And that's a big part of the problem, is that like depressed people least of all want to talk about depression. Like no one wants to talk about it, least of all depressed people. So it's this sticky situation. And yet if we who battled with depression or frankly anything that's hard to talk about, if we're not willing to be the voices, then what are we waiting for? Who are we waiting for? And yeah, I've been thinking about it a lot the last few years. I've been going to therapy and I've been spending more time on trying to process aspects of my inner life that have felt in some disagreement with who I am and have caused me strife, have impacted my quality of life, impacted my productivity, impacted my personal relationships. And, reaching a point where married, 32, like, I just don't want to be dealing with these things anymore. I know there's more there to unpack and uncover. And my wife really helped me find the inner strength do the work and spend time exploring those things and trying to understand them better, trying to understand how these thoughts, feelings, and emotions become behaviors, how those behaviors become a pattern of behavior over time, and how really that those patterns of behavior over time are what dictates one's life. So I wanted to get more control over my life, I guess is one way you could put it. So I've been doing that, but quietly. And of course, we've been talking about mental health in various forms through podcasts. We've incorporated it into Stop the Bleeding. It's a big part of Powering Through. So a lot of the programs that Believe is responsible for, the emphasis on mental health related issues has been there for a little while. And that's because I think that's important. But I haven't been willing to personally kind of put my name out there until I did. So to your question as to why, it was in May, just before WFH, although that wasn't why, that was just sort of a mile marker for people, the World Congress in Scotland. But the reason was actually I had lunch with Jeremy Griffin, who's the executive director of the New York City Hemophilia chapter, and some of his staff just before leaving for Scotland. And as Jeremy and I were saying goodbye, he had walked me to the railroad station in New York, and we're kind of chatting about the lunch and how it went. Some of his staff is new, and they hadn't met anybody with hemophilia and all that. And then just as we're saying goodbye, just the way he's just squared up, he's like, one more thing I want to ask you about is when are we really going to start meaningfully doing something about mental health in the community? And there was just such a desperation in the way he stated it. And I was like, I know, I hear you. And he referenced knowing that there are guys out there who struggle, who aren't necessarily willing to talk about it, and how that's a problem. And, he said it respectfully. It's a problem. Of course, it's everyone's individual choice whether or not they want to disclose their health information. That was a given in the conversation. But again, if the people with the thing aren't willing to speak up, then who are we waiting for? So on my train ride home from Jeremy and thinking about the Congress, and fortunately, because Believe was really busy with Congress-related stuff, there wasn't a lot of other things going on, so I had a little bit of brain power available. And on the trip over, I had all these notes that I'd been scribbling for a few weeks as I've been thinking about this topic, and then I just decided to synthesize all that and give it some kind of flow. After Jeremy was yet another person who asked me a question along those lines. And I'm just sick of people asking that question. It's like, why are we still asking the question? Let's at least talk about the things that are working and failing, but we're not. We're just asking questions, and we have to be doing more. So that was my way of trying to do more.
I kind of shared my story a little bit with depression, with Lori addressing mental health. She did an article interviewing a couple guys that struggled with depression, and that was the first time I really shared, besides in one-on-one conversations or at Powering Through, but more publicly shared that I struggled with depression too, around having a chronic condition, and mainly with my needle phobia that really drove my hatred for having this disease. Taking that step and actually sharing it publicly, I think that is a huge step to admit that this is going on with more people and being more open about it, and at least getting it out there.
Sorry to cut you off, but I can't help it. What you just said about my needle phobia and how that really drove my hating of hemophilia. I'm paraphrasing a little bit, but that's essentially what you just said, right?
Yeah.
That right there, something like a needle phobia, right? That causing a level of depression or mental angst to a degree where you then hate the chronic condition that you will always live with. That just goes to show the power of mental health. And the needle phobia to me, because you are a mountaineer, because you've been on the top of the world, because it's easy to look at you and think courageous and brave, and that's all true, but that doesn't mean that you are therefore not a person who can qualify for a phobia like anybody else. You can be born with anything. And that phobia driving you to hate hemophilia, even though you've been able to do so, and you're talking in past tense, so it's not like you're I hate hemophilia. I understand, but I think it's so important the way that our thoughts and feelings drive our sense of identity in the world and can cascade into things like hate. I mean, it's such a powerful word to use that I just wanted to underscore that. Sorry to interrupt the flow.
No, I think that's an awesome point, and when you say past tense, but it's not quite past tense even, and I think that's an important thing to keep addressing is I still have that needle phobia and I still struggle. I have those days where I sit for an hour or two trying to infuse, and in those moments I hate having hemophilia again, and it's an up and down battle, and it's consistent. And I think there's a persona out there of myself maybe and you that, we have all this figured out. We have our conditions figured out, but it's not always figured out. We have our ups and downs.
Very true.
I still, every time I get a bleed and I can't move and I'm sitting on the couch, not being able to be active, like it still hits me the same way. It's still a up and down battle that I think being honest about that too is that, like, even if we seem like we're doing great, it doesn't mean we don't have struggles, and we can be open about and honest about that instead of pretending like we got it all figured out all the time.
I think it's tough when in a position of leadership, which you certainly are with Gut Monkey and in the role that you play within the community writ large. And I acknowledge that I'm in a similar position. It feels scary, maybe even scarier to admit that there's something that, makes me feel vulnerable, that makes me feel weak or less than, that can lead me to real dark feelings and self-loathing, and it's not about overcoming it. It's about managing it, about being curious about it, trying to figure out what lies beneath it, and trying not to let it dictate too much. This is a tactic, but one thing that I've gotten very good at is recognizing that if I'm having, because I do have days where I literally wake up and just, it doesn't matter. Today's going to be tough.
Yeah.
And I can be in Los Angeles, I can be in New York, I can be on a trip that's I could be on a vacation in Costa Rica with my lovely wife at a beautiful villa that is heavenly and gorgeous and everything you could ever want. And I could wake up that way. And that's just how my day is then. I'm only going to be able to move the dial a little bit. I've come to learn that in 32 years, that on those days, it's not about how do I jump from 0 to 100 and become like my idealized vision for who I am to the world. No, it's actually, for me, it's about trying not to do harm and trying not to push myself much at all. It's about being gentle on those days and accepting where I'm at and moving as productively as possible while recognizing that for the most part, there is nothing on my list that if I were to take it off the list for the day would be all too painful. Like, it's fine if you need to rearrange things, like take care of number one. I've gotten good at that, but I used to be terrible at that, and it would cause much bigger problems.
Yeah, I have those same days. Then I get more down on myself for having a off day, where I'm like,
exactly.
Yeah, and it's not healthy. It's not. I've trying to work on the same thing you're working on, and it's super challenging, but it's a process, right?
It's a total process.
Yeah, and I'm super excited today to be talking with Debbie De La Riva, about some strategies we can have going forward and what we're going to actually do to change what's going on in our community and how we're going to chat about mental health and depression and suicide and being more open about what's going on in our community. So super excited about that today. For our expert guest this month, we are really fortunate to have Debbie De La Riva joining us. Debbie has been an advocate and active member of the bleeding disorders community for many, many years, and she's really making it her mission to change how we look at mental health in our community. Thank you, Debbie, for joining us today on the Ask the Expert podcast.
Wonderful. Thank you for asking me on.
So first, if you could share with our listeners just what is your background in the bleeding disorders community and in working with mental health conditions and challenges?
I look at my life between before and after my son was diagnosed with hemophilia, and now everything just kind of lines up going in the same direction. I am a licensed professional counselor and have been so for the past 20 years. I've worked in a number of settings. I've worked in a private psychiatric hospital. I was a stress management therapist for them. And more recently, I've worked as the executive director of a local Mental Health of America affiliate. So I've been really involved in that way. And then the other side of it is I feel like I've been thrown into the world of hemophilia since 1994, when my beautiful son was born with severe hemophilia. My whole family got involved with NHF for pretty much the get-go. I got to be involved with a program that was under the education department of NHF at that time. It was called First Step, and now it's Steps for Living. I had the honor of being an executive director of the Lone Star chapter of NHF for about 12 years, and have just been doing advocacy work on a national level, on the local level. I think some of you might know that my husband was a chair of NHF's board of directors, and my daughter had an amazing experience with NYLI. So we're all pretty involved.
Yes, very, very involved. A lot of people know many members of your family, which is pretty cool. So yeah, so you do have an interesting background with the mental health aspect, and that's obviously what we're going to be chatting mostly about today. But I think there's this ambiguity to like what mental health actually means. So could you just dive into like what does mental health mean, and what are some of the conditions kind of that can lead to, some challenges with mental health?
So, they define mental health as the absence of mental illness, and that doesn't really help anyone, because really what mental health is, it's just a state of well-being where people can cope with normal stressors within their life, and they can lead a satisfying life. That is what the definition of mental health is, just being able to be present in your life and living your life to the fullest. But if you look at it through the definition of mental illness, people get it confused so many times. Many times they use like an adjective for mental illness to be an insult to someone. Really what mental illness is when someone's ability to think or feel or behave is impacted so negatively, and it really just gets in their way of their life, their ability to work and to study, and it affects relationships as well.
That's a really interesting point, because we talk about mental health, but it's actually we should probably be talking about mental illness, not mental health, right? Because that's the challenge is actually mental illness, not mental health.
Well, actually, then I'm glad to even be able to talk about it, because I think what happens is people see it as a line between you either have mental illness or you don't. You either have bipolar disorder or you don't. But what we really need to do is see it as a continuum, because if we're really honest with ourselves, we can see that there was different points in our life that we felt more mentally well, than other points in our life. So it just depends on what we're going through and different factors. So I'd love to look at it from a continuum point of view.
So what are kind of some of the most common challenges with mental health?
So what we know is that 1 in 5 Americans in any given year are experiencing some degree of mental illness, be it depression or anxiety, substance abuse, alcohol abuse. They're the top 3 in terms of prevalence. The other side of that is that of the people who are experiencing mental illness, over 50% of them are not accessing care. It's just they're going without for all kinds of different reasons. One of the striking things to me is that how long it takes to get help once someone's been diagnosed with a mental illness. They say it can take up to a median of 10 years. Wow. I have a personal experience with that. With my mother was not diagnosed with schizoaffective disorder until she was the age of 53. I mean, she never got help for it, because no one knew what it was.
Is it just our medical system isn't looking for that, or is it just people aren't open about what's going on with themselves?
Yeah, it's more of a combination.
Okay.
And in her case, she had a medical condition, Parkinson's, and they didn't recognize at the time that depression was a major component of it.
And Debbie, just as Patrick now, just to jump in quick, I just want to make sure I have these numbers right, because I think it's pretty remarkable. So if we're saying 1 in 5 Americans on an annual basis experiences a mental illness in some way, it's about 65 million Americans. That's about 65 million people. And then half of those aren't receiving treatment?
Right. That's just what we're taught in mental health first aid. And there's all kinds of different reasons for that. Many times people who have mental illness they're the last ones to know. They have a lack of insight as to how they're coming across to people and how they're conducting themselves.
It's just an amazing amount of people. That's over 30 million people who aren't receiving treatment, and you're saying that those who do, there's an average of 10 years. The numbers really put the crisis under a very bright spotlight.
And I mean, I'm very hopeful now, because there's a whole field of study called integrated behavioral health, where we're beginning to understand the correlation between mental health and chronic conditions and how they affect one another. It goes both ways.
Can you elaborate on that a little bit? Like, how do mental health and chronic conditions kind of affect each other?
Yeah, I think the best way to explain it, at least in this context, is about mental health and hemophilia. You can see how someone's mental state can affect their physical outcome, because when you think about a depressed person, sometimes it takes a momentous amount of effort just to lift a telephone or get out of bed, much less take the initiative to self-infuse or to go to doctor's visits or to let someone know that they're in trouble. There's with depression, there's many times a sense of hopelessness, like it really doesn't matter if I infuse anyway, I'll continue to have a bleeding disorder and be in more pain. Sometimes with depression you have a negative worldview, like does it really matter anyway, especially when there's a strong degree of pain associated with it.
No, sorry, Debbie, I just wanted to riff on something you had just mentioned from my own experience, talking about that hopelessness feeling. I'm someone who, in general, is very hopeful, very optimistic, who believes in the power of positive thinking and tries to use that to help will into existence things that no one else is looking to bring into the world. So on one hand, I totally appreciate the power of hope and how hopeful I am. But on the other hand, I understand those feelings of hopelessness. And I had an interesting experience earlier, just a couple months ago. I've taken my fitness really seriously this year, in large part to help my mental health. My fitness and my mental health are very good friends, I've come to learn. And something that has startled me a couple times in the last couple months is when I'm in a fitness class, when I start to lose the will to push. Will is not characteristically hard for me to find, but when I'm not feeling well, it flies away. And my apathy goes up, and this sense of, I don't care, who cares, it doesn't matter, this hopelessness that you're speaking of. And I have found that now that I've incorporated exercise in such a meaningful way, I can at least flag through exercise when that will is really hurting. And it's a scary feeling because it feels far from who I am characteristically, but I now recognize it as, oh, you're maybe not so well today. Today's going to be a tougher day for you. Just tune into that. It's okay. Slow down. You don't have to push as hard in this class. It's just an exercise class. So it's been nice to incorporate fitness and then be able to use that as an indicator as opposed to, strolling through life. And like you said, it's often the ill person can be the last to know or to acknowledge it.
No, and I'm so glad that you've been able to get on the other side of the vicious cycle, because we know that when we're feeling physically impaired and having lack of mobility, we're less likely to do anything about it, and it just begins to spiral. But the opposite's true. Yeah, I was really excited to see that NHF, for example, came up with this idea about having a personal coach available to us. I could see the benefits in that.
Absolutely. Just to kind of add to that a little bit, I guess everybody probably knows that I'm quite physically active, even just with compliance with like my infusions and stuff. When I have injuries or, a bleed and I can't move and I can't get off the couch, like that, those have been some of the darkest days I've had, especially when they've been like bad bleeds, where I know it's like weeks at a time. Like the physical fitness is the thing that gets me out of that darkness a lot of times. And when I can't utilize physical activity, I just feel kind of stuck. And I felt that hopelessness many, many times. So that really resonated with me as well, that feeling of hopelessness and tied to that chronic condition where, you can't move and you're in pain. And you mentioned talking, about mental illness and that there is a correlation with chronic conditions. People with chronic conditions tend to have more challenges with mental illness. Is that kind of correct?
Exactly. In fact, now it's becoming well established and almost common knowledge, which is very hopeful to see. We know, for example, that one of the studies that they said with Parkinson's disease, it's correlated with 51% increased likelihood of having depression. And with cancer, 42%, and diabetes. We've seen that there's a direct link, and it's consistent among different ages and different disease groups. And I've been really recently encouraged by seeing the amount of research that's going on with depression and hemophilia. I'd like to do a caveat that the reason why I continue to say hemophilia as opposed to other bleeding disorders is it seems to be the chronic condition that we're studying most within our bleeding disorders.
When we're talking about mental illness and hemophilia and bleeding disorders, are we mostly talking about depression in correlation with that? Obviously, the risk down the road, if depression's untreated, is the risk for suicide. Would you say that's like what we're mostly talking about in correlation, or is it other mental illness?
No, what I'm really finding is there's three different silos in terms of the mental illness has been focused on with the research, and the major one being depression, because we know someone's state of mind can, like we established, can impact his feelings of self-worth. But we're also talking about anxiety, too, and how anxiety can play into the treatment of hemophilia if someone is paralyzed by fear. Like Chris, I know that you talked openly in the past the fear of needles themselves, talking about a concrete fear and how you overcame that. But this fear of the future too can have a paralyzing effect on how someone goes about treating hemophilia. Sometimes people have different anxieties about financial burdens that they're experiencing, and that can have negative effect. The other major source of research they've done is on hemophilia and the prevalence of substance and alcohol abuse, and we all know that we've heard so much of opioid dependencies. So I'm not saying that it's a causal effect. I'm just saying that it increases the risk because many times when people are depressed or anxious, they could tend to self-medicate in order to get the misery to stop inside their minds. Or sometimes people, again, we talked about that hopelessness, sometimes it can lead to high-risk behavior like substance abuse.
It seems like it's kind of a spiral too, right? Like the anxiety can lead to depression, which can lead to substance abuse. It seems like they're all very interconnected in some aspect.
Exactly.
This flow between anxiety, depression, negative thought patterns, low self-esteem, bad choices, regretting. It's not so linear. It's not so kind of straightforward. I did want to follow up with you on a piece of what Chris had asked about, which was on suicide. And I've gotten very curious about when we talk generally within the community and within the country about mental health, how often are we actually trying to talk about suicide and suicide prevention? And on the other side of that, I know I grew up with a sense that if I were to ever tell anyone that I had anything close to a suicidal thought, I may immediately be thrown into a straitjacket, flung into a paddy wagon, and brought to an institution that would remove me from my friend's family and life as I know it entirely. And you just weren't ever supposed to say that you have a suicidal thought. That was just like a terrible, you just don't say it. And yet, if I'm going to be honest, I have. Over the course of my life, I have had those thoughts. I'm waiting for people to burst down the door. No one's come in. I think I'm still safe. But there is this sense that we can't say that without there being like alarm bells and everyone's perceptions of someone has changed. But I feel like if we're not willing to put that on the table and flesh that out, that we're continuing a culture of repression, and that does not seem to be working. So I'm curious to know your thoughts on those two things: the stigma associated with talking about suicide, and then how often are we saying mental health because we're afraid to get to suicide?
To speak about the stigma itself, you're right. We are light years away from where we need to be with the negativity that then is conjured up when we talk about mental illness, because there is this extreme view. Again, you either have it or you don't. People don't know enough about it many times to know that it's highly treatable. And recovery and resilience is a natural part of it. So people get these extreme views about it. People have a very low understanding of what mental illness is in general. Again, it's not a death sentence. It's not necessarily saying it's something that's going to be plaguing you all of your life. So that's the big mystery behind it. But I once saw on YouTube a comedian said, that when I had my children, people were showering me with gifts and flowers and visits, but the day I had my psychotic breakdown, it was like no one was on the other line. I was also talking with my son about how much he's willing to share, sometimes within the visits themselves to the HTCs. And he was sharing with me that there's, again, what you were talking about, there's this overprotectiveness, I think, that we have especially when the kids are young and growing up with hemophilia, and they can just feel that if they were to be brave or courageous enough to talk about their insecurities or how they're not feeling so great mentally, a lot of insecurity about what will happen next.
I can speak to that as, somebody that was struggling with some depression, and I'd go to the HTC visits and I'd see the social worker, and they ask lots of great questions. But in that moment, I'm just like, yeah, I'm doing great, even though it was definitely just like a mask of like pretending I was doing great. But I didn't feel, I think I've talked to Patrick about this before, but you grow up at these HTCs too. So I'm seeing a social worker that I've seen for decades, and it almost feels like a second mom, and trying to admit that you're struggling with depression or some sort of, anxiety or something to, someone that seems like a family member. It seems pretty daunting at times.
And I was also wondering too, there's this is a good thing that's going on in our community, but sometimes I think it can be taken to extremes. It can be a detriment. Having hemophilia, many times I think we get these messages that we should be these heroes and we have no limitations and we should be excelling with hemophilia. It's kind of the ads that are giving us those messages that we see in all the different factor products or what have you. And I think that puts an extra degree of pressure on not revealing perceived weaknesses, much less a mental health condition.
Yeah, I know it makes you kind of feel like since we have treatment and medicine and everything like that everything should just be perfect and fine. And it's like you don't have a chronic condition, but you definitely still do. And it's definitely still hard.
This podcast is brought to you by the good people at Living with Hemophilia, the online community brought to you by Bayer. Living with Hemophilia is the destination of choice for a plethora of useful info like medical and non-medical tips, helpful advice, information on programs for all ages and stages, leadership opportunities and initiatives, sewing patterns, and videos, the best videos. And because it's on the internet, it's easy to find. Simply type livingwithhemophilia.com into your search bar and there you are. Thank you, Internet. Join Bayer's community of fellow hemophilia patients, caregivers, and advocates as they put the live in living with hemophilia. You can even like them on Facebook, and that's even better because then you can use emojis on their Facebook page and receive all the latest updates. So, check out Living with Hemophilia. And before you wish happy birthday to that friend from 3rd grade or share a funny meme about cats and Mondays, head over to Facebook and like Bayer's Living with Hemophilia page. You'll be glad you did.
You had mentioned earlier, that there has been some research done around depression and hemophilia, not necessarily other bleeding disorders yet, but can you kind of touch upon what kind of research is going on around mental illness and hemophilia and what those results are looking like?
Definitely. I spent a great deal of time researching this, and what I found is really the more recent information has come about since about 2010. And there have been some very significant research pieces. For example, Sue Trail, she's the social worker of the Louisiana Treatment Center. She was published in the Journal of Blood Medicine in 2014, and she was really investigating the link between all the psychosocial challenges of someone that has hemophilia and inhibitors and what they go through and how this can be a contributing factor to mental illness, depression in particular. And she found a lot of evidence to support that. Arizona Hemophilia and Thrombophilia Center, they did a very small but a very significant study too, where they had 41 gentlemen with all different degrees of hemophilia, and they came up with a number stating that 33% of them stated that they had a degree of depression, so much so that it had a pretty big impact on the way they live their life. That fits kind of with what we know on the national average, like we talked about before, 20% of people, having a mental illness any given year. Even though it's a small sample group, I think that it's very significant what they had to say, because when they delved in deeper as to, what's contributing to your depression, they were able to identify two things, and that is a lack of social support and unemployment were two contributing factors. And these gentlemen were all the age of 24 and above.
Debbie, Patrick again, and I'm curious, depression can make physical symptoms worse because it affects, and we have in our outline here, the way people think, because hopelessness can affect compliance, and we've spoken about that. The way people feel, low self-esteem due to being different or not being able to provide. We've touched on that, and Chris and I were speaking before you came on about our personal experiences where it's like, when you feel depressed, then you feel bad about feeling depressed, and here we go down the road. But the one that I'm curious to hear you speak to now, the way people behave, high-risk behavior. Can you speak a little bit about that? It's interesting because on one hand, depression and negative feelings of certain consequence associated with apathy, hopelessness, these very kind of inactive sensibilities. And yet there is a correlation between depression and high-risk behavior, which is certainly not a sedentary, doesn't sound like something a hopeless person would engage in, but there is a correlation there. So can you explain that a little bit for us?
When I'm talking about high-risk behavior, again, I'm talking about things that in the end will bring about negative consequences. There's been a study about how they've correlated depression with increased being accident-prone, increased number of injuries. Somebody is just not thinking properly, not thinking carefully enough. They're talking about automobile accidents. The high-risk behavior I was talking about is we talked about is the increased use of alcohol and substances, knowing full well that it affects liver functions, but yet continuing to do so.
There's something of a lack of regard for consequence. Like you mentioned, high-risk behaviors that result in negative consequence. I suppose that's where, in depression, a sense of consequence, a sense of like how this is going to play out in the long term, it doesn't penetrate. If I'm not feeling well, like how my choices today will impact me in 20 years just doesn't frankly feel important. So I think that's exactly what you're speaking to is that divorcing oneself from consequences leads to driving more recklessly, eating more recklessly, not bothering to look both ways, all kind of common practice safety behaviors that you throw out the window because who cares? Doesn't matter, that sensibility.
Yeah, especially because depression can really cause kind of a warped sense of time. Like you said, it hurts now, and I can't see beyond it. And then, of course, keep in mind I'm talking about severe depression when I talk about things like that.
Severe depression is something that like affects your day to day, but there's different levels of that, correct?
It definitely so. In fact, I see that we really haven't teased out that information in the research that I've been able to access. I need to also mention the HERO study and how they really did a fantastic job at identifying all the factors that can affect hemophilia, all the psychosocial factors. But I haven't been able to tease out the information on just the U.S. population. Because as you can imagine, the research is very skewed by the fact that we're talking about the entire U.S. Most, as we know, 75% of the world doesn't have access to adequate medicine and treatment. So it definitely skewed the numbers, but they did a great job at identifying all the different factors involved, and I look forward to knowing more about the U.S. population.
Thank you for going over the research that's going on, and it's exciting to see that there's actually something happening and that people are paying attention to mental illness in our community. I think as we've discussed in the past and discussed with Patrick, that it still doesn't feel like enough. And recently in our community, we've experienced some loss, and that has really inspired, I think, the three of us to have this podcast and to do more. And so I'd love to have you dive into what has inspired you to really address these mental health challenges going on in our community, and what can we do in the future going ahead to tackle these huge problems, because they are going on. Like you said, there's higher prevalence of depression in our community. So what can we do going on, and what inspired you to do this?
I always knew, because of my background and knowing that stress itself can create someone more likely to develop a mental illness, and knowing about hemophilia on a personal level and watching my son, understanding all the personal stressors and how it is hard to manage. And I knew this on an intellectual level, but it really wasn't until I became aware that we lost Barry Hardy due to suicide in February of this year did I actually feel this sense of fire of, oh my goodness, if someone of the character and the status of Barry would feel this type of desperation that would lead to his decision to end his life, I realized that that is probably the tip of the iceberg of what's going on in our community. And it gave me a sense of fire about how I needed to dive into this and to help others recognize the signs and symptoms of depression or suicidality, so in hopes that we can prevent these tremendous amount of losses that we have in our community. And I'll be focusing on Barry's story because I was personally touched by that. I knew Barry for many, many years. And secondly, knowing that he had such a high profile in our community, I knew that we needed to address it and talk about the elephant in the room and to begin educating people about looking for the warning signs so we can prevent this from happening. Just to let you know that in the very beginning, the first few after Barry's sudden loss, there was just a handful of us that actually knew the nature of Barry's death. And I struggled with, when and how. I knew the community needed to know, but when and how are we going to convey his story? Because I was really legitimately worried about how this will impact our community. Barry represented hope for us. He represented living your full potential. He represented living for others, being selfless and helping the world that we live in. And so I wanted people to still have those feelings and thoughts about Barry. And at the same time, because it can coexist in someone, you can be of incredible strength, but also have your own personal struggles. And so I just couldn't help but talking about it. And I'm so glad you guys have put this podcast together.
I was actually with Patrick when we found out about Barry. And I think Barry and I were kind of kindred spirits in a lot of ways, not only because we did fundraisers for saving life, physical in nature. I think it just caught me completely off guard. I had just gone on a trip with Barry. We were, sea kayaking in the San Juan Islands. He seemed like he was doing so good. And I think what you bring up is just incredibly important, that you never know what's really going on in someone's head. Like you said, Barry had done so much for our community. He was always thinking about everybody else and how he could help everyone else. And yeah, it was just shocking to find out that this happened to somebody that was so spectacular as Barry. And it lit a fire for me too. And I think, I don't want to speak for Patrick, but for Patrick as well, that, me and him had talked about mental illness and the challenges we've gone through, but we weren't doing anything about it. We were just kind of chatting about it with ourselves and maybe a few other people, but that was my big wake-up call, that we need to talk about this more and we need to figure out a way to tackle this.
Barry being of such a high profile, his death and his suicide gave this conversation more urgency, but he's unfortunately not the only community member that we've lost this year to suicide. There is an issue, and we know that there is an issue with depression in our community. We were talking about that. So we've acknowledged in our conversations, and worth saying here explicitly on the pod, that while we're referencing Barry because of his profile and all that comes with that, it is not to discount or otherwise dismiss other individuals that we've lost in our community to reasons related to mental illness, depression, or suicide. So just wanted to state that clearly. There is also, actually speaking of that, community-wide impact, there is this idea that suicide, if it's spoken about or if somebody brings up that a death was related to suicide, it will put the idea in the minds of others. Debbie, in your training and experience, is there any merit to that idea?
No, there isn't. In fact, it's quite the opposite. People do feel like you're going to, again, put that idea that suicide is an option for those who are severely depressed. But no, what it does is that when you invite this type of conversation, you're actually giving someone a release, a place to vent, a place to be real, to talk about their feelings. And it's like a pressure cooker. If you release some of the steam, then you can help people feel better about the world. You help that person feel like they matter or that you care how they fare. The other thing is that it gives you that chance to tell them that by dying by suicide, by committing suicide, that's an impulsive act. It's a permanent solution to a temporary problem. Letting someone know that I hear your pain and I want to let you know that this can be seen like a wave. And if you can just stay on long enough, it'll pass, it'll dissipate. But without having that knowledge, or even having without having this culture that it's okay to talk about it, we eliminate that possibility to be able to be with someone and help them know they're going to be okay.
Chris was even sharing earlier how it was at a Gut Monkey trip once before he started working there. But when he first started talking about depression out loud in an environment where it was acceptable and it was safe, and that camp environment around a campfire is so magical because it does create an arena that doesn't belong to anyone. So we're all out of our comfort zones. No one's on anyone's turf. And those camp conversations, as a camper, as a counselor, as a volunteer, some of the most profound conversations I've ever had with any human beings of any age have occurred with young people and children, frankly. in those camp environments. So yeah, to your point about it being the opposite, Chris, what you said earlier, I think is an example of how the willingness to talk about, say, depression in this case, it didn't cause you to have a negative reaction. In fact, it invited you to realize you were part of, a greater community and that you weren't so alone.
It not only like gave me an outlet to voice feelings that I never felt like I could voice before, but it also helped me feel like I wasn't the only one dealing with those issues. And realizing that other people were struggling too just made me feel like I could rely on somebody else and somebody else could understand the same challenges I was going through, and that maybe just by talking it out with them and seeing what worked for them to get out of those kind of ruts and those holes, that community bond that, hey, we're all experiencing this in some way. Like if we talk about it together, we can get out of it.
And also it speaks to, there's this other myth that's surrounding suicide, and that is that there's no warning signs, that it just seems to happen out of the blue. And I know many times that feels that way, and many people could have felt that about losing Barry by suicide. But at the same time, if we had more information, if we had more education about what to look for, I'm just using Barry as an example because he is the person that I know. A personal and family history of depression is a major warning sign and contributing factor to committing suicide. And after I lost of Barry, I went and I looked at all the different interviews he did in the last 10 years, and he openly talked about his depressed feelings and even feelings of suicide. Another contributing factor is major life changes. We know that Barry lost his job of 27 years to Hewlett Packard he was working for, and he recently lost his mother. Again, some changes, and he was about to move from Houston, where he lived most of his life, to Florida to live with his family and work somewhere else. And so, again, the whole reason for this podcast, in my eyes, is just to know more about it so we know what the warning signs are ahead of time.
Just so people do know, could you just kind of list off some of the warning signs that people should be aware of? And then, what do you do if you think you're picking up on those warning signs?
Definitely. So the warning signs are, again, someone obviously threatening to hurt or to kill oneself, talking about dying either in social media or through conversations, when someone's seeking the means to how they would kill themselves. Again, expressing a lot of hopelessness. The world's not going to get better, or the world would be a better place if I wasn't here. They can have extreme mood changes, go from rage to anxiety. Another common occurrence happens many times is that someone who used to be characteristically kind of depressed or melancholic all of a sudden has a feeling of euphoria or peace because they've made the decision and they're at peace with it. Withdrawing from friends, people not participating in hobbies. I know that Emily, Barry's sister, let us know that over the Christmas break, Barry wasn't riding his bike anymore, and that's very different for him. They usually complained because he would barely be with them during the break because he'd be off on his bike. And some other symptoms of giving away your prized possessions too. Those are the major symptoms of that someone might be considering suicide.
And what would your recommended steps, if you recognize this in a friend, family member, somebody that you're close with, what steps should we be thinking about or taking in order to help a person?
Definitely, this is the part I'm most excited to talk about because it's many times the opposite of what we feel we'd want to do, but really what we need to do is, once you have a nice rapport with someone or it's a family member and it's a good peaceful time to talk, ask the person directly, do you have feelings or thoughts of harming yourself or killing yourself? It's important to actually say the words killing oneself as opposed to saying, do you want to harm yourself? Because people are going to say, no, I'm not going to harm myself, I'm going to kill myself. It's a real distinction of words. So really asking the person that question, do you have thoughts or plans of killing yourself? And then, of course, if the answer is yes, you want to continue that conversation. You want to acknowledge pain they might be feeling at the moment, and then you want to also probe into to make sure to see how suicidal they are at that particular moment. Do you have an idea of how you would kill yourself? Do you have the means to do so? Again, it's asking an initial question and just continuing to probe.
If you ask those questions and you have reasonable, assumption that they might kill themselves, what's the next step?
The next step, obviously, is to never leave them alone. If you can't be with them right that moment, to make sure that they're safe, and a lot of reassurance. I know it's a kind of an art between acknowledging your pain and reassuring that they're going to be okay. Some things that people forget to do is ask them, ask the person, what do you need right now to feel safe? Or who has helped you in the past in these circumstances? Or is there someone I can call right now that can be helpful to you? Again, we get all tongue-tied, but we just continue to ask the questions and reassure and engage them in the answers.
I'm also struck by this statistic that you shared that 67%, so 2/3 of people who attempt suicide had a doctor visit in the month prior to the attempt. We can't get people to go to the doctors, apparently, unless they're on the verge of suicide. Like, that's extraordinary.
No, and that's exactly true, because what they're looking for, they're having these somatic issues of migraines or stomach issues or pain within their body. And we're in the fix-it society. We think that there's got to be a physical reason we're feeling this. It can't be tied to our feelings of desperation. And so that's why, and then another statistic related to that is 37% of those who have attempted suicide saw a doctor within a week. And that's why it's so important to have this conversation that we're having right now. If we can integrate assessing for mental health problems with our HTCs, we can be better at identifying, assessing, getting the help someone needs. And we don't have to have this conversation after the fact.
So along those lines, we need to be figuring out ways to address depression, anxiety, and those high-risk behaviors before they get to a point of suicide. So as a community, what do we do to make that change? And how do we address these issues going forward?
Well, the first thing I want to do is acknowledge the efforts that the HTCs are making, because many HTCs, that's just standard protocol for someone to go through, and they do a small, short survey for depression. And so that does happen, and I just want to acknowledge it, but encourage them to continue to do so, and then continue to ask the questions. The second thing is what you all are having the courage to do today, and that is talking about it as if we're talking about, what happened in the last session at NHF. I mean, having this conversation. One of the things that I feel the most hopeful about, and what I'm driven to do, and that is I am involved with an organization called the National Council on Behavioral Health, and I am a certified mental health first aid instructor, which means that I'm someone who's gone through a whole week of training, and you became certified in teaching others two things: how to recognize the signs and symptoms of someone in a mental health challenge or a crisis, and how to have that conversation to offer support and to get people to help. I would love to see this go nationwide, meaning that there's 12,000 people who are certified instructors in the United States. So it's my passion to either be an instructor for an HTC or to help them find someone else who can help them learn more about them, mental health first aid, and make it as common as CPR.
Would that be something that the HTC staff would get trained in, or is that something that community members could also be trained in?
Definitely. This is something that is a training I'd like to offer to the HTCs. I'd like it to offer to chapter staff and community members in general, because it is true that that we are a family, and in the bleeding disorders community, and we have to be there for one another. And the more that know what to look for and how to help, the better off we'll all be. So that's my vision, is to have as many people as possible go through mental health first aid, and there will be a stronger community by that. Some other ideas is that I know that when you go to your HTC visit, it's a time where you're trying to see all the different members, the nurses and the geneticists and social workers, and it's a cramped time. I know there's an earnest desire for us to spot when someone's having a hard time mentally. But many times I think some people are reluctant to look for it because we don't know the next steps. Like if somebody is having a hard time or feeling hopeless or helpless, what resources are there? Where can we send them? And so I'd like to see in-services for our social workers so they can spot very quickly, all the different resources within their local area, how to get help. Help's out there. We just need to know where to direct people to. And sometimes, like we talked about before, Chris, that you might be super reluctant to talk to your treatment center for whatever reason about how you're feeling mentally. And I would love to see us having an online confidential screening accessible to everybody in our community. It's already out there. It's called Screening for Mental Health. And you just take a short survey. It lets you know, not that you have a mental illness. It says that you have a lot of factors that look like this could be a challenge for you. And then at the end of it, it can direct you to local resources. Another idea is that these amazing young adults came up with this app called Not Okay, where basically you can set it up where when you push a button, a message goes out to 5 people that you've already designated and let them know about it. And it says, I'm not feeling okay right now. I could really use a phone call from you. Or I'm not okay right now, and they can actually locate where you are, anywhere in the United States, and send help. It's called Not Okay. It costs it costs $1.99 a month, and it's now being used by the National Foundation of Suicide Prevention. You know, I was looking for information on mental health and NHF and HFA's website and all these different ones, and I know our primary focus is on the information about our physical being, but I know I had to look really close, and I knew what I was looking for to find information on resources for mental health. I'd like to see that more prominent on websites. For example, I'd like to see the suicide prevention hotline somewhere that's accessible.
And just to throw it out there, the suicide prevention hotline number is 1-800-273-8255. And that'll obviously be in program notes too. But I think that's a really good step as well, having that on our National Bleeding Disorder website. Well, Debbie, any final thoughts before we wrap up? I think these are some really awesome steps for moving forward and things that we can hopefully make a change with mental illness in our community. But any final thoughts?
I no way mean to paint a bleak picture about how having a chronic condition, inevitably leads to mental illness. I'm just trying to make the connection that, number one, it does exist. These stressors can create all kinds of mental health challenges. 2, it's okay to talk about it. And 3, the more we know about it, the more we can recognize it and help one another. Absolutely.
I think acknowledging that this is a challenge in our community, and it's a very real challenge, just as much as, self-infusion or bleeds, it's the same thing that's part of dealing with a chronic condition, and being aware of it makes it easier to manage and address. So I totally agree. Like, talking about it, getting it out there is the way for us to continue to move forward. Patrick, any final thoughts from you?
I want to thank you, Debbie, for the work you're doing, because as someone who battles with his own mental health, mental illness challenges, knowing that you are not only helping people access resources, but just generally raising the profile on the conversation by leading these kind of talks, doing that kind of work at the patient organization level, and taking the lead on being a strong, kind, empathetic, gentle voice for people who are struggling. It means a lot to me knowing you're out there. I feel like you're making my existence easier. So thank you for that, and thank you for today.
No, thank you for the opportunity. This is important, and you're right on by featuring this in your podcast. I did have one more thing to say, that we will be offering a session on mental health first aid at the annual meeting in Orlando this October.
Excellent. That's awesome. Thank you so much, Debbie, for joining us today on the Ask the Expert podcast. We will have all of the notes and all the research papers that we discussed, links for those in the program notes. And yes, just thank you so much for tackling such a challenging topic, just being so open about it. And thank you so much.
Thank you, Debbie.
Oh, you're very welcome.
Have you checked out Living with Hemophilia yet? If you have, kudos to you. Not only are you eager to join this exciting community of discourse and helpful information, you're also a keen listener and patron of the arts. But if you haven't taken a swim through livingwithhemophilia.com, take a moment to pull it up on the old internet. I think you're going to love it. Helpful content, relevant updates, and most of all, a bunch of people going through the same things you are. It's a growing part of the online Living with Hemophilia community brought together by the good people at Bayer. Also, put it on your Facebook to-do list. Hit the like button on Living with Hemophilia's Facebook page. It's a good alternative to looking at the slideshow of your neighbor's recent foot surgery. I mean, unless you're into that sort of thing. Living with Hemophilia from Bayer. Check it out.
And that is all for the Ask the Expert podcast. We'll be back next month with another expert interview. Bloodstreammedia.com is your one-stop shop for all of Bloodstream Media's podcasts for the bleeding disorders community. Once on bloodstreammedia.com, don't forget to follow the links to subscribe to the Bloodstream podcast, Ask the Expert podcast, Powering Through podcast, and the Bloodline podcast on iTunes, Stitcher, Spotify, or wherever you listen to podcasts. Have an idea for a future episode of Ask the Expert? Have a question you would like to hear an expert answer to? Email us at mailbag@bloodstreammedia.com. You also find Bloodstream Media on Facebook at facebook.com/Bloodstream Media and on Twitter at Bloodstream Info. This episode of Ask the Expert was written by Chris Bombardier, produced by Patrick James Lynch, Rob Bradford, Joshua Sterling Bragg, Audra Friedman, and Colby Crow. Artwork by Ryan Geelan and Katie Wright Mead, and the Ask the Expert pod is edited by Allison Stoney. I'm your host, Chris Bombardier, and until next time, keep on climbing.